Welcome to the PT Lounge. My name is Austin Madriaga. I am a licensed and practicing physical therapist. I'm here to do interviews with healthcare providers in the Las Vegas Valley, interviewing them into what their career is like and what their life is like in and outside of work. On today's episode, I have my friend with me, Kristen, who is a cardiovascular ICU nurse. So we're going to get to know her a little bit more. So welcome to the PT Lounge. I appreciate you coming on.
Thank you for having me.
Yeah. So let's start with who you are. So go ahead and introduce yourself, where you grew up, and what you do.
So my name is Kristen. I am 25 years old. I was born and raised here in Las Vegas. My parents are from the Philippines, but they moved all around from like Saudi Arabia to New Jersey, and then I was born here.
Oh man, that's a lot.
I know. I mean, I wish I got a cooler place, but I guess Vegas is all right.
Yeah.
It's all right. Yeah.
Yeah.
Like I said, I work here in Las Vegas at one of our local hospitals. As for outside of work, I do enjoy working out, walking my dog. I
Yeah.
love Shiba Inus. They're my jam. I also love trying new food, traveling, hiking, anywhere I can just, get out of that space of some stress I can get from work, but then also just spend time with my family and friends.
Yeah.
Yeah.
Yeah, that's good. I think it's important to have a good life balance
Right.
with work, especially in the field that you're in, which we're going to dive deep into because I think
Ooh, yes.
not only is the ICU intense, but cardiovascular is pretty intense as well. So we'll get into that in a little bit. But
Yeah.
let's go ahead and talk about your journey as a nurse. So can you talk to me through your journey from start to, applying for nursing school? What were your thoughts about trying to apply and your journey and overall?
So, we'll date back to, why I wanted to do nursing in the first place. My mom has actually been a nurse for over 30 years, and she did work in the ICU. So, of course, I had influence from her. I had influence from other family and friends who were nurses. And then I've always found myself in healthcare opportunities, whether that's being, a secretary at a desk in one of our hospitals here in Las Vegas to volunteering at a hospice. I've always loved caring for other people. It's sometimes it's just hard to say that you should put yourself first, but I find myself always putting others first. And always just caring for others. So that's where my journey began. I did take the nursing assistant program in high school.
Oh, okay.
And that's what actually geared me towards, interacting with people and seeing how I can take care of them. And then because of that, that's when I'm like, yeah, I still want to do nursing in college.
That's good. Yeah.
So I went to UNLV. I actually did
UNLV reppin'.
Yeah.
Let's go. Yeah.
Rebels.
Yeah.
I did my undergrad over there. I did, 2 years of prereqs. And if, I talked to other people about getting into UNLV nursing specifically, it's tough. It was really tough. But I pushed through doing my prereqs. And then you apply about your third, fourth year to get into the nursing program. It's a 16-month program, so very rigorous. 4 semesters, 2-week breaks in between.
Wow.
Yeah. So with that, you needed to, take your gen eds, your science classes. You had to get at least like a B or higher. The thing about the point system is that actually it's just a point system. There's no interview process. They just want to see what kind of grades you have.
Right.
And then you have to take an entrance exam, which is the HESI, or I know some other schools does the TEAS. But I did the HESI, and then I ended up applying. I actually took off a semester as I waited to see if I got in or not.
Yeah.
And this was, I think, when was this? This was like 2019, I think. Yeah, 2019, I applied and I got in. So It was, I had those nights going like back and forth in terms of like, am I going to get in or not? Because every semester they'll release like, oh, how many students did actually get in? It's always like a slim chance. And the nursing program at the time only accepted like 40 students to 50, I think it was like 56 students for mine. So there's always so many applicants, and then to find out like, oh, you're one of them.
Yeah.
Like that's amazing.
Yeah, you get a lot of pride
Yeah.
just from being one of those ones that get accepted.
Oh, for sure, for
Yeah.
sure. And it's like I remember I got that call. I was at work. I was a clinical assistant at the time, and I was like, yes, I do accept for sure. So it's like I was so happy at that moment. And then, of course, nursing school came, and it was just I want to say, like, long story short, it was the most challenging time of my life, but it was definitely the most rewarding because for 60 months, I'm seeing, these people I see every day and get close to, and they also are on the struggle boat in terms of, trying to just pass with a C to,
Right.
to pass nursing school, having to go to the hospital to get information on your patients and write a care plan, maybe even 2 care plans, like the night before clinicals, and wake up at 4 a.m. to drive to whatever hospital I'm going to for that day.
Yeah.
And it was a crazy time, but I mean, now I look back, I'm like, I actually conquered that. And even with those endless nights of like, oh my gosh, I can't do it. I can't like finish school. Now I'm sitting here as a registered nurse.
Yeah.
Which is awesome.
Yeah. Did you ever feel like nursing school got easier throughout those 16 months? What were some of the consensus from you and your cohort in terms of how you felt from start to finish?
What's so different from undergrad to nursing school is that now it's just trying to pass. Like
For
undergrad,
sure.
like even high school, you're like, yeah, I need to get the best grades, like so I can get into the best college. But then now it's like once you're in nursing school, it's like you don't really have a competition. It's mainly on yourself that you need to be motivated and to like do your best so you can graduate and get licensed as a nurse. So I want to say like, did it get easier? I mean, in terms of like how to study and like how to do time management, yes. But in terms of information, like there's so many areas of nursing that is
Right.
like so different from everything that I definitely had my strengths in like pharmacology. Like I loved learning about how a drug works, but then when it came to like medical surgical,
Yeah.
like if you ask a nursing student or like ask anyone who has gone through it, they'll say like that was such a tough time.
Yeah.
Yeah.
I give you props because pharmacology is one of the toughest
Right.
for me. But again, like everybody goes into, nursing school with their own strengths. For someone wanting to go into nursing school, would you say that there's any difference between a school here in Las Vegas versus a school in California? Or I know there's multiple nursing school here in
Right.
Nevada. Is there any difference in any of them?
You know what? I want to say now that I've like interacted with others who didn't, graduate from my school, it's honestly, if you can get through nursing school and pass your NCLEX, then that's all that matters at that point. I know there's different degrees in terms like you can get an associate's, you can do a bachelor's, or if you've had like a previous degree, as I heard now, you can go straight into getting a bachelor's of
Oh, wow.
science and nursing. And that can be within like a year.
Man, yeah.
And I'm like, wow, that's
different.
already tough when you're like, compared to like 60 months, I'm like, that's even less time.
Yeah.
But those who are like, okay, well, maybe whatever they graduated in first, they're like, well, let's further that. Or they weren't, finding a career in what they wanted to do, then they went to nursing, which is like
Yeah.
good for
Definitely.
them.
Right.
Yeah.
So the program that I went to for physical therapy school, it's a 3-year program where you go through 2 years of didactics and then 1 year of just clinical experiences.
Right.
And I know of DPT programs now that are accelerated to like 2.5 years,
Wow.
and even some that are hybrid. And if I were to give anybody some advice, taking the accelerated route is tough.
Yes.
3 years alone in any graduate program is tough. And now that you're adding so much more in such little time can be very challenging.
It is. And, I had classmates who they had families, they had to work. And I'm like, as a full-time student and still working, like, I give props to people who worked during nursing school because, like, even after your lecture, after you're done with like a day of classes, you still need to go home. You still need to study. Like, there's so much to study. And it's like, well, if you also have work, like, how are you balancing it out? But people made it work, which is, awesome. But like, in terms of going to school, like, I'm glad I didn't work, because I feel like I would have just went crazy.
Would you say most people work during nursing school?
I don't know. I want to say, like, some people will actually work as a nurse apprentice. Have you heard of that position?
Is that during nursing school?
It is during nursing school. So I actually didn't learn about that position until I'd gone to nursing school. But essentially, those who are in the program, they can find a job called a nursing apprentice, and then essentially work in a unit. It might not be their desired unit, but it's still a job, and where they can be able to do skills that they've learned in nursing school. And as long as they're supervised by an RN, they can do those skills.
Oh.
Yeah. So it's instead of you'll get checked off in clinicals, but when you're working, you can practice your skills even more. Yeah. Which I thought is...
It's a win-win situation.
It is.
Yeah. Were any of your cohort doing other jobs outside of nursing related things?
Not that I know of. Maybe I think they worked in the food business, but even then they were only working at least like once or twice a week. Yeah. I feel like if you were to do more, it'll be really hard. Yeah. But I mean, for those who've done it, I give you props, but it's just, there's so much information in nursing school that you won't know how it is until you actually do it.
Yeah. Yeah. Let's talk money now that we're kind of into that, because graduate school is not cheap. Nursing school is not cheap at all. Right. For a lot of people. Right. So now it's February 2023, and I'm sure you're a few years out from graduating. Right. How much did nursing school cost in terms of the program that you're in or you were in, and how did that compare to other nursing schools that you may have applied for?
So if we go back to high school, so I was already applying for nursing programs. This was actually when I didn't want to stay in state. I actually wanted to go out of state. But I think when I was 18 years old, I was kind of small-minded in terms of really, now that I think about it, it's wherever I go, I can still become a nurse.
Oh yeah, definitely.
Yeah. So, I actually got accepted for a school in California.
Ooh, let's compare. Yeah. Let's compare numbers.
Okay, so I got accepted for a school in California. I was already ready to go. I went through orientation. I already went through okay, this is going to be my dorm. This is how much everything, bed and board is going to be. And I'm on my way home from that trip, and I'm something just does not feel right. I remember looking at the papers of how much everything's going to be. And I'm wow.
There's a lot of zeros at the end.
There's a lot of zeros. Yeah. And I'm just is this what I actually want to do? Do I want to leave for 4 years, to a different state, but then be paying so much? And then that's when I was you know what? I can't. I'm going to just stay here. I did not decline my offer from UNLV. Okay. And I ended up just accepting it still. So I had to turn down the California school because of, zeros for sure. But in terms of tuition here, I think estimated it was around 25K.
For the entire 16 months?
Yeah.
Okay.
Yeah. So what worked out was I did have scholarships from being here in Las Vegas. So that worked out. And then, of course, taking out loans. But now that I'm working, I can actually pay off those loans, which is, it's so nice to see because it's like I had my parents help me, with school, but now it's like now that I'm working and now that I'm making that much money, like I can pay all of that off.
Pay it off.
Yeah.
And I've noticed that from a lot of people that I know who are nurses, where they took out loans, and even though we're talking tens of thousands of dollars,
Right.
the amount that you're getting paid is quite a bit to where you can afford not only living a life, because I see a lot of nurses traveling.
Living their best life.
Yeah, and we'll talk a little bit more about that, because if you haven't seen a nurse who's traveling, you're not looking hard enough.
You're not looking hard enough. I totally agree with you on that.
Yeah. So with physical therapy school, now that I've graduated and I'm working, oftentimes I tell people that are trying to get into physical therapy school, find the cheapest school that has the most proficient professors.
Right.
Because no matter what, in your first job, your employer is not going to ask what school you went to or how much loans that you have. You're still going to have those credentials at the end of your name. Would you say that same thing to a future nurse?
100%. Like, for me, when I was doing my undergrad and it was like, no, I only want to go to this school. Like, if it's not the school, it's like nothing. Well, now I'm like, if you can get into nursing school, that is amazing. Like, wherever you go and you get that degree, like, again, it's what you just said. It's just whatever, like, it's those initials at the end of your name. Like,
right.
That's what matters.
Yeah.
Like, you worked your butt off to get your degree. Like, I'll ask, like, where did you get your degree from? But at the end of the day, if you're working, like, your butt off on the floor, like, showing that you are proficient enough in what you're doing, then that's what matters.
Right.
Yeah.
I have a coworker who sits pretty much next to me. I went to UNLV, and this coworker went to Toro. And at the end of the day, we both have PT, DPT at the end of our names.
Right.
But one person has a lot more loans, and that's the other person. And me, I have much less loans.
Right.
And we're getting paid probably the same exact amount with the same amount of experience.
Right.
And so I think a lot of people need to realize that even though we get into this mindset that I want to go to this school, I have family that went to this school. I have friends that went to this school. This is where I grew up. Some people get stuck on their own city as well.
Yeah.
To where they miss opportunities outside.
Right.
People need to realize that what is your goal with school, right? You want to graduate.
For sure.
And start making money. So pick a spot that's going to be in your favor. And I think a lot of people don't realize that. They just still get so stuck on one place, right?
Yes. Like, again, like with going to UNLV, like that's all I knew. Like I didn't even actually know other nursing programs existed in the Valley until, like people get rejected from nursing school. They don't get it on their first try. Like it's actually not always often. They'll have to get it on their second or third try. But then that's when they're like, all right, what else can I do? Like, what other programs are there? And then now I'm like, wow, there's like Nevada State. You can go to CSN. Like, that's great because, those are other options in terms of not only like costs, but distance. Like that, if you're living closer to there, then that's great. Then that works out for you. And then it's like, if you can save a couple bucks,
right? Yeah.
Then go for that. Like it's
16 months is so short when you consider being a nurse for a very long time.
Right.
Right. Because you can pretty much make enough money that 16 months, you can probably pay off fairly quickly depending on your lifestyle.
Of course. And that's how I see so many of the people I graduate with.
Yeah.
Living their best life, traveling like maybe every month, every 2 months, like, probably have paid off their loans.
Probably.
And it's like, there's so many opportunities in nursing where, it's such a secure job. But I do want like people who are going into nursing school to remember, like, it's not just about the money.
It's not.
You have to love what you're doing.
Yeah. With any field, but specifically the medical field.
Yes.
Because burnout is real.
It's so real.
Whether you're a nurse, a CNA, a PT, OT, there is burnout everywhere.
Right.
And if you work in a hospital, because we both work in the hospital, if we didn't mention, we both work in the same hospital.
The same hospital, yes.
Yeah, we both work in the same spot. So I think
Yes.
it's crazy.
And it is crazy because, we're in definitely different areas of the hospital.
Yeah.
But we both know and like we see firsthand that, the hospital we work at, definitely so busy. The acuity is so high and that burnout, you'll see burnout in so many people.
Yeah.
Yeah.
There's a couple times every few months or so when I get to hear the capacity of our hospital, and it's almost always over capacity.
Right.
And I question why a hospital can even be over capacity.
It's crazy.
Right. And when I was in a different hospital, I was still doing my clinical rotation in a separate hospital, but I would be in the kind of the ER area, and there would be obviously the patient rooms, right, where it's one person per room.
Right.
And there would be some beds or some chairs in the hallways. I kid you not, I would walk down the hallway and there would be chairs and beds all along the walls. And some of these patients were kind of like contact isolation or airborne.
It doesn't matter now.
And COVID at the time, it's like, okay, people are in their patient room, but then everybody else is in the hallway.
Right.
Transitioning into that, you were a nurse during COVID, right?
I was a COVID nurse for sure.
And I know we're kind of way past that.
Yeah.
But tell me a little bit about your experience during the peak of COVID as a nurse.
It's crazy, Austin, because I was just thinking about this the other day, just like walking my dog, because I was like, is this a fever dream that I actually was working during a pandemic as a new grad nurse? And it's like I did. And it's like to what, 2023 now? We're like 3 years past this pandemic. You know, COVID's still going around, but not as many people are talking about it. So I graduated 2020, and then spring of 2020, I passed my NCLEX in the month of June. And I actually didn't get to start working until like October.
Oh, okay.
Yeah. So it was actually very difficult for us nursing students or, new grad nurses to find a job because when COVID happened, they were only looking for experienced nurses.
Oh man, that's very tough.
Yeah. So, and what I mean by experienced nurses is like, a lot of us wanted to work in the hospital, as our first job. But there was actually not many opportunities for us. It had to be like home health or, doing something outside of the hospital, like if you can. I remember once I passed my NCLEX, I was just looking at all the job opportunities.
Like, please accept me.
I was like,
to
please,
one spot.
yes. And all of them were like 2 to 3 years experience.
That's
like,
ridiculous.
We're looking for like the demand for med surg, but it's for those experienced nurses to take care of these patients who had COVID. At the time we didn't really know much about what this disease was, what was going on. And then, eventually they had a job opportunity at the hospital we're working at for a new grad residency program. And it was actually for the ICU. I actually did not want the ICU at first.
Oh, yeah.
Did you know that?
Yeah. No, I didn't know that.
No, I was actually set on becoming a pediatric nurse.
Yeah.
So I loved my rotations in nursing school, working with kids. But actually, there's not many jobs for pediatric nurses at the time because it was all mainly the adults who are being affected because of this pandemic.
Yeah.
So I was like, well, this isn't my first choice, but it will get my foot in the door. It's a new grad residency program where, I'm not just thrown into the fire, even though I was thrown into the fire with this pandemic. And then just see where I go from there, because I was so set on like, all right, I'm only going to stay like 6 months in this job and then quit and then go to a pediatric unit. Like that's all I wanted to do. So I did the new grad program. And then we had preceptorship, which is we followed an experienced nurse on the floor for a couple weeks. They actually wanted to cut us off like a week or two early because of how crazy this pandemic was going.
Oh, man.
Yeah. So luckily that didn't happen. I was able to finish all of my weeks of preceptorship, but man, being a new grad, not only during a pandemic and starting in the ICU, it was like very much intense.
Yeah.
That's
tough.
It's tough because, with like safe patient ratios and patient to nurse ratios, we get about like two patients to like one nurse. So at this time, it was like 3 patients to one nurse. And that, if you can imagine, it's all ICU patients for sure, like all intubated, all on the vent, all having COVID. So imagine having to put on our PPE, be in the room, take it off, and then something alarms, and then we have to do it all over again.
Yeah.
So,
and then you add one more patient into that to a 3-to-1 ratio.
Yeah.
That's a lot.
Yeah. And it's like I didn't know what to expect. And as a new grad nurse, I was still learning myself.
Yeah.
Like then I was like, yep, I'm basically thrown into this fire.
Yeah.
Trying to figure out how to navigate as a new nurse and this pandemic. And then it went on for another year and then another year. So it's like it got the hang of things, but also like is so tough. Like just trying to learn for myself on how to take care of these patients because I'm so new. Luckily, I had the help of, more senior nurses. But even then, they were so busy.
Yeah.
Like they had their own set of 3 COVID patients, like on multiple like IV drips, like were so sick.
Yeah.
And this was
That's intense.
and this was at the time where, they canceled all elective cardiac surgeries. So we became the overflow unit, and that overflow literally took up all of our beds.
Yeah.
And it was just all COVID. So I didn't really know much about cardiac at the time because I was just focusing on how to take care of a COVID patient. And then once the pandemic kind of, I guess, slowed down a little bit, like our numbers were starting to go down, then that's when I was kind of thrown into how to take care of a patient after a cardiac surgery. And then that was like a whole new learning process again.
Gotcha.
Yeah.
So you've been in your unit for 2 years, two and a half?
2.5 years. Yeah. 2.5 years.
So 2.5 years later, can you describe what a cardiovascular ICU nurse is and does?
For sure. So a cardiovascular ICU nurse, our duties are to essentially take care of post-op surgical patients who go through either like open heart surgery or they get their heart valve replaced if they've had a heart attack. We'll take care of these patients who might come out on a device to help support their heart. And we'll keep it in for a couple days until they're a little bit more stabilized. And of course, we get our mix of like ICU patients if, like surgery was canceled for that day. And we'll respond to our code blues. So anyone who, needs their heart or they need to be resuscitated and need higher level care, then they'll bring them to us.
Yeah.
Yeah.
Yeah, definitely. It's an intense place.
It is.
Yeah.
It's so crazy because I actually work with these nurses that I guess I grew up with because my mom used to work in the cardiovascular ICU. So they were they are my mentors still, but they are like, oh my gosh, you've grown up so fast. And now you're taking care of these kind of patients that your mom was taking care of.
Yeah.
I'm still mind blown because these patients are they're pretty sick.
Yeah.
There's patients I'll see who come in for an open heart surgery and then after 4 days, they get to go home walking just fine, feeling so much better, no more chest pain. And then, you get those other patients who have so many pre-existing conditions and, may or may not get better. But I'll have them for 1 week and then come back and they might still be there.
Yeah.
Yeah. We also take care of patients on ECMO. So it's the last life support system that us nurses in the CVICU can get certified to take care of. And I actually did not know that device existed until I went to work or like learn more about it. And now like I'm actually taking care of these kinds of patients.
Fun fact. Well, there's two fun facts here.
Yeah. I already have a feeling. I know what you're gonna say.
The first one, fun fact, ECMO, the hospital that we work in, we have the only ECMO. What would you say?
Like certification? Like yeah. We're the only ECMO certified unit
in Nevada.
Nevada.
Yeah.
Currently.
The nearest one would be Utah,
Yes.
California, Arizona. So
Yes.
if someone is going to need ECMO, they are going to our hospital.
Yes.
Yeah.
They're coming straight to us. If there's like someone who, has signs of acute respiratory failure, we have a criteria list in terms of who we accept. But if we can, we will get that patient on ECMO ASAP.
Yeah.
Because there's some people I see like on ECMO either for, I already know what your other fun fact is going to be. For someone who's on it for maybe 90 plus days to I've had a patient who's like 20. She was on it for like 3 days.
Well, I did not know that.
Yeah. She was on it for 3 days and then we got her off.
So let's rewind back.
Yeah.
ECMO, for anybody that doesn't know, I'll kind of introduce it. And if you just want to follow off that, ECMO stands for extracorporeal membrane oxygenation.
Right.
And ECMO is basically the last resort to live.
Yes.
Right. So correct me if I'm wrong, but it basically oxygenates your breathing for you.
Yes.
Does it also circulate your blood for you, or is it just your oxygen?
Yeah. So you know what? There's two forms of ECMO. There's a venous ECMO and a venous arterial ECMO. Our venous arterial ECMO are actually mainly for those who have cardiac issues. Our VV ECMO is mainly for lung issues. So long story short, if you think about it, ECMO is like a dialysis machine for your lungs.
Yeah.
So it's helping filter out good and bad blood. It goes to this huge ECMO machine that takes out, all any like toxics, takes out the CO2, returns it back to you. And what we do on our end is we actually, monitor. They're 1-to-1, so we monitor them very closely. We look at their labs, we look at their oxygenation, and then that's how we determine how to wean them off.
Yeah. It's an intense piece of machine.
It is.
I've been to your unit, and I've seen the ECMO machine. If someone who does not have medical knowledge just looks at that, it's pretty crazy how it works. If you understand that it's keeping you alive. It's pretty crazy that someone was only on it for 3 days.
Yeah. Because
I know that the mortality rate for ECMOs is pretty high. So if you make it out alive out of ECMO, you're one of them ones that make it alive.
You're a lucky one for sure. Like you're a lucky one because it's we have like patients who are on it again for like a while. And it's like a seesaw kind of thing where they'll do good for like a good amount of days and then they kind of have a few steps back. But with who we've taken care of, they have successfully gotten off ECMO in our home. Yeah.
So let's talk about fun fact number 2.
Yes.
Continuing on to ECMO, we actually had the same patient.
We did.
And I did not know that until, I think it was during, while I was treating her, or it might have been after. But to kind of sum it up, there was a patient who needed ECMO, and she went to your unit.
Yes.
How long was she on your unit for?
I think it was more than 90 days for sure. Yeah. Yeah, because she transferred from another hospital. I think we got her on ECMO right away. And then I already even remember in the unit, seeing her all the time. Yeah. And then next thing you know, she's not there and she's in rehab with you.
And then she ended up on my caseload.
Yeah.
And what's crazy is that I was already following this patient's story through, honestly, LinkedIn and some other social media.
Right.
And so I was like, okay, this is a really cool case that is in our hospital. Come to know it, I don't even know how long it was. I think it might have been like a week or two later. She shows up onto my caseload, and I was like, wow, this is
her.
This is her.
Yeah.
She spent, I don't know how long she spent in our rehab, but
Yeah.
I worked one-on-one with her. Well, I had my clinical instructor, but she was my favorite patient. And if I were to tell a story about one of my favorite patients, it would be this one. And
Yes.
she's memorable to a lot of people. There was a lot of like news coverage for her, which she did not like for a lot of parts.
Right.
She was very reserved, and it
Right.
was a lot of spotlight on her. A story about this patient that we both had. So she shows up onto our rehab unit, and she was still on the trach collar,
Right.
and she did not have the PMV, the Passimir valve. So for anyone that doesn't know, the Passimir valve is a basically talking valve
Right.
that allows you
To speak.
speak.
Yeah.
So when she came up onto my unit, she was not speaking at all, right? I had to communicate with her through hand gestures. She showed me pictures of her family on her wall. And I kept working with her with my clinical instructor, and I believe it might have been like 1 to 2 weeks later.
Yeah.
And she had the Passimir valve, and I heard her voice for the first time. And when you don't hear a patient's voice for weeks on end, and you hear it for the first time, it was mind blowing. And
is.
I kid you not, when she started talking, everybody crowded her room because it
Wow.
was just so emotional. She was crying, we were all crying, and it was probably the most memorable parts of my encounter with the patient.
Yeah.
And it's crazy because she started off with you
Yeah,
in your
yeah.
unit, and then she ended up with me, and then we were able to send her home. So I think it's pretty crazy how someone who is on a life-saving machine goes from potentially not making out alive to going home.
It's amazing how ECMO works. Again, the mortality rate, it's on the higher side for sure. But with success stories like her, and to get to know her a little bit more, she went home to her baby that she had just given birth to before she got COVID. And for her to go home to her baby and doing so much better than when she first started, it's amazing because you got her when she was hopefully going like close to going home. I had her when we were just getting her out of bed, walking with the ECMO machine like in our unit.
Yeah.
And that's where like I love the PTs I work with because they like orchestrated the whole thing on trying to get her out of bed.
Yeah.
Because it took like a village just for us to get her even up like and walking. And then she made like rounds in the unit.
Yeah.
And just seeing that, it was like, that was still when I was pretty new to ECMO, but I was like, wow.
I was new to PT,
Yeah.
and I was like, how do I take care of this patient?
Yeah, you can do that kind of thing. So her story is definitely like a very memorable patient.
Yeah.
And it's crazy that she crossed paths for both of us.
Yeah.
So
And to add on to that, she had COVID. But before her going to the hospital, she had a newborn.
right.
So throughout her stay in the acute care through rehab, she had not met her newborn son.
Yeah.
And there was one day, I think that we might have been working with her for about 3 to 4 weeks or so.
Okay.
And she was getting better.
Yeah.
She was just on a nasal cannula. And we took her outside. We planned the whole thing. And this was a time when she was supposed to meet her newborn that she has not met. And it was so emotional because it was like 3 PTs. It was her 2-year-old daughter and then her newborn son. And on top of that, what was kind of sad was that her husband passed away too.
Right.
So as you can imagine, it was very emotional, but so satisfying as a healthcare provider because you get to see people not only go home, but life-changing experiences.
our work is challenging, Austin.
It is.
It's challenging, but again, it's rewarding to see, all of the hard work that we do for these patients, because we, at the end of the day, want you to go home. We want you to go back to, if you can, to like where you were at before. Maybe even better if we can. But for her story,
It's the best.
It's amazing.
Yeah.
That, we had someone come in like that, and we actually got to work with her, both of us.
Mm-hmm.
And then now she's home.
On
Yeah.
another side note too,
Yeah.
my back then my clinical instructor who I was working under
Mm-hmm.
and my current or my previous OT that I was working with,
Mm-hmm.
they were supposed to get sushi with her the other day.
Wow.
And she is still on
Yeah.
oxygen to this day.
Yeah.
But they had to cancel it because my coworkers had to run late.
Yeah.
But yeah, it's crazy where life takes you.
It is. And
But we get to see
yeah.
that.
We do. And I must say, like, our hospital, for it being so high acuity, so busy, I want to say you might not even be able to see these kind of patients anywhere else.
Yeah.
Yeah. to be
Especially
quite honest.
ECMO patients,
Yeah.
because it's a fact that we are the only hospital in the state of Nevada that has it.
Mm-hmm.
So we get to see things that nobody else really sees in this
Right.
valley.
Right.
So we've talked about a lot on the
We-
good stuff
on the good-
about
yes.
ICU nurse and nursing
Mm-hmm.
and working in a hospital. Let's get juicy a little bit in terms
Right.
of everybody wants to know what the good and bad side about
Mm-hmm.
nursing is. Are there any challenges of being a nurse, but also an ICU nurse? And to add on to that, a cardiovascular ICU nurse.
You're already adding it all, Austin, because it's just piling up, and that is just for sure. Like, it's just burnout.
Yeah.
Burnout can happen. As a nurse, I think just nowadays, like, I always have this conversation with more experienced nurses that has healthcare been like this before, or like has nursing changed for them? And everybody I've talked to is like, yes, it's changed. Are they more tired? Yes. Are they, are we wanting to get paid more? For sure.
Yeah, definitely.
Yeah. And it's, I think about like, well, is it just our ratios here in Nevada? Is it like our nursing that's, having such challenges? It's everywhere.
Yeah.
Like, I have a friend who's in Seattle. She said it's not too bad. But then if you see news coverage about New York and, these nurses going on strike, like,
There were so many.
there's so many
Yeah.
that they're also facing what we're facing.
Mm-hmm.
So I think about, like, well, if I go somewhere else, am I going to experience the same thing? Like, I even have a friend who moved in our same hospital. She moved from the neuro ICU to NICU, so the children's side of the hospital. And I asked her, I'm like, well, are patient ratios still the same? And she's like, they're still pretty bad. Like, I thought it could have been a little better because it's, babies. But
Right. But it's not.
it's not. They're getting like 7 to 8 babies to one nurse in the, the NICU.
That's not okay at all.
It's not. And that's, again, back to shortages. And, I was researching the other day because I'm like, why is this all happening kind of thing?
Right,
I wasn't taught this. I mean, I knew about it in nursing school, but I didn't know until firsthand that I'm a part of a career where people are already wanting to leave.
Within a few years.
Right. I found a statistic the other day, and it was like in 2022, 29% of nurses want to leave their profession,
Wow,
like
that's
regardless
crazy.
what license they have. In 2020, so I guess when the pandemic started, it was 11%.
Big difference.
It's a big difference, and it's pretty sad to see that it's doubling.
Right.
And it's like, so how can we combat this kind of thing? Like, they're saying it's about resources for nursing school. Of course, it's expenses. It's the places you work at. If you work at a corporate versus non-corporate hospital, like, it's such a tough time, I want to say, for nurses. And do I think it will get better? I'm actually not sure. But I know for sure, like, I'm not the only one who feels this way. there's so many other people who are advocating for each other, that this profession, like, we are taken seriously, but there's so many more things that, we should be rewarded for.
Yeah,
Yeah.
definitely. I 100% agree.
Yeah, like that we should be rewarded for. And, if that means increasing pay, amazing. If you can just get us like a couple more nurses, like, great. Like, there hasn't been a day where I came in and it was fully staffed. It's always going to be understaffed.
It should not be like that at all.
It shouldn't, because how are we going to be able to take care of these sick patients in the ICU? And then in general, all these patients who are in med surg or like, other parts of the hospital when they're so short staffed. Like, how am I going to give as much attention as I can to all of these patients when I don't even have that time, because you're just giving me more patients that I shouldn't really be having.
Yeah.
But they have to, because there's nobody else to take them.
Right.
Yeah.
As many success stories as there are in the medical field, I think many people don't realize that they just see us as providing care for patients, but there is burnout on the other side.
Yeah.
And there is such high standards in terms of, higher ups or management that tell us to take care of our patients when we're not being taken care of.
And we have to put ourselves first in order to take care of these patients. Like at the beginning of this podcast, I said, yes, I went to nursing in that I take care of others first, but it's like days where I go into work and I see the assignment and I'm like, oh, I'm tripled again, or like this, this nurse has to take technically a 1-to-1 patient, but has another patient. Like it's insane, because you already can tell, not even by like getting report, they're already burnt out.
Yeah.
Yeah.
Yeah. Burnout is real.
It is real. And
it happens too quickly too.
It does. And that's where, like, as a new nurse, like when I started, I was in my like early 20s. So I'm like amongst, so many older nurses. And I'm like, well, why am I feeling so burnt out already? I'm so young. And it's just everything piling up. It's being a new grad in the ICU during a pandemic. Like, how am I going to survive this when, like, I may get support from others, but it's not always a lot of support, especially when these nurses are taking care of their loaded patients that can be so busy, and no one can really help you out.
Yeah.
Like, I found myself definitely my first year in nursing, where I'm like, I would go home or like on the way home, and it's like a 35 minute drive for me, like crying because of how hard I had it at work. I even found myself, like, this is when I was still night shift, and I remember I had such like a tough assignment, and it was already like maybe 3 a.m. I still needed a chart, but I still needed to do like my med pass, like do stuff for these patients, and I felt like I just couldn't do it. And that's when I like just broke down in the break room. I was like, I can't, like, am I actually like right for this job? Like, I know they say there's a learning curve when you're a new grad nurse, but it's like, did I make the right decision starting in the ICU kind of thing?
Yeah. You question all those things.
Yeah, you do. And it's, again, like even imposter syndrome. Like, I find myself, a little bit better with it, but hands down, every like time I would go to work, I'm like, do I belong here kind of thing? Like, should I even be a nurse kind of thing? Like super anxious. Like, I literally come like 30 minutes before my shift, like just sit in my car, try to like, mentally like get myself prepared on what I'm going to be thrown at.
Yeah. You need that time for yourself to
you do
mentally prepare.
Yeah.
Because if you can't prepare yourself, you're not going to be able to take care of somebody who needs it essentially more than you, because they're almost under their deathbed.
Yes.
Right.
Yes.
And so even though we have to stay positive and think about all the things that we have, we still need to be prepared.
We do. And it's not even just the patient. It's the family.
Yeah.
The family that, are not used to seeing their loved one with a breathing tube in.
Yeah.
With a bunch of medications running continuously. Like, they're questioning everything on what's going to happen. Like, are they going to live? Are they going to get better? Like, I can't even answer that because I work, I have to take it like hour by hour,
Yeah.
especially in the ICU.
Yeah.
Yeah.
Could you go a little bit into that? How do you handle talking to a family whose their family member is on this bed and they've never experienced this before?
It's tough because, you know, in nursing school, I had to learn how to communicate with not only the patients, but I have to talk to family. And you know, they may not always know all the medical terms. So I try my best to kind of like put in simple terms. But of course, if they're like wanting to make life decisions for their loved one, I have to have the doctor with me. But in terms of like talking to them, I'm just the type to tell them everything that's going on. Like I'll be like, okay, I'm going to do this with him or her. I'm just letting you know because I don't want you to be alarmed. If you hear anything going on, it's just me. I'm going to clean up the patient. If you can step out for a couple minutes because I don't want him, you know, to develop pneumonia or like get bed sores. I need to check his back kind of thing. So it's just walking through what you're doing with that family member or friend who's there, just to help ease them because I try to put myself in their shoes that like, I want to know what's going on. Like if I were to imagine if it was like my parents or like my siblings that are in that bed, like I would definitely be super anxious on what's going on. But as long as you talk to me about like, you know, give me updates on what you're doing and, you know, if there's anything I can do, then let me know.
Yeah.
Like I always tell my family members of that patient, you know, who has a breathing tube that they can hear you. You know, if they're sedated or, you know, they're not being very responsive, they will know you're there if you even touch their hand. Like I've had patients be like, yeah, like I've heard the music you're playing in the background.
That's interesting.
Yeah. They can hear the
it?
Conversations. Yeah.
Wow.
So, you know, it's keeping that environment non-stimulating, but to the point where like if they wake up, they're calm kind of thing. So you'll find me always putting on like some nice piano music on the TV, like right by their ear. Or I ask the family members, I'm like, what kind of music does your loved one like to listen to? Because music therapy, I believe in. Like,
wow, that's something that I would have never really realized unless you're in that unit working with them every single day.
Because you have a billion alarms going off in the ICU. It's so hard to keep track of all of them. It's whether it's like an IV pump or the ventilator, and even that will shake things up for the patient and the family. So I'm like, might as well, like, why not put some relaxing music or like I'll have a family member put on like white noise or like ocean sounds, just to keep them calm, kind of thing.
Yeah. Let's go back to burnout. I like to talk about this because it's very prevalent in nursing from all the nursing friends that I have.
Yeah.
So nurses have a lot of burnout.
Right.
And we talk about why is there not enough staffing? Well, maybe because there's nurses that are burnt out.
Yes.
So how would you tell a aspiring nurse to still go into nursing even though burnout is really high? How do you convince somebody to do what you do?
See, I'm like, if I was not a nurse right now, being aspired to do internal nursing and like see what's going on right now, I probably wouldn't do it.
To be real.
To be real.
Right.
Because it's like, why are you working so hard when like you deserve more kind of thing, you know? But I still love what I do. Like it definitely has its challenges, but at the end of the day, when I see a patient go home after a couple of days after getting better, and even one thank you for like saving my life.
Yeah.
Like
those you can't beat those.
You can't. And even like them remembering like your name because they go through so many nurses or so many staff that goes in and out of the room.
Yeah.
Or like remembering that you gave them like a blanket or something. Like that's what like keeps me going because it's like I know that even the tiniest thing I'm doing makes a difference
Yeah.
for them. So for those who want to go into nursing, like, remember, money is nice. Yeah, like there's, there's so many other careers you can do. But if you love caring for others, if maybe you've had an experience with a family member where you took care of them and that inspired you, then remember that's your why you want to become a nurse, why you're going into this profession. It's not because of how much money you're making. I mean, money is nice, but you need to love what you're doing, because if you're just doing it for like the cash, well, you're going to easily get burnt out, because you're going to be like, why am I here kind of thing.
Yeah.
Yeah.
Yeah. In those tough moments, whenever you're working with a tough patient or a tough case, it's always important to look at why you decided to be a nurse in the first place, or any other medical field. Because when we look back at why we joined this career, there's so many positives, but we can't let a negative just negate all that.
Right.
Yeah.
Right. You have to remember like why you're doing it, and I go into work, I actually think about like 3 gratitudes for the day. And it's always like, whenever it comes to work, it's like, why I'm doing this. Like, why am I still a nurse?
Yeah.
Like, why, like, am I, why did I still choose to be in the ICU kind of thing? It's just having to remind yourself, because it's definitely going to be worth it, especially for those patients who go home and they thank you for everything that you've done.
Right.
Yeah.
Because for a lot of times you think you're not doing enough. And even just one thank you or even, one hug.
Right.
I've hugged patients before and it's nothing like hugging anybody.
Right. Right.
Or even hugging family. It's so different. Like if I hug a friend compared to I hug a patient, it's night and day.
It's a different feeling, and it's a great feeling.
Yeah.
It's a great feeling. Like, it's just so nice whenever I have a patient. They're like, you know what? You're like one of the best like people like to be taking care of me, and that makes me feel so good, because I'm like, well, this is why I'm in this career, because I want to take care of you. I want you to get better. I want you to get out of here. As much as I love, seeing your face and taking care of you, you need to be home.
Yeah.
Don't be in this hospital anymore. Go home.
Yeah. I say this to probably 99% of my patients. I say the same phrase. I love to treat you, but I love to see you go home.
Yes.
And don't take offense to that.
Right.
Because my goal as a physical therapist is to send you home, but keep you home. I cannot send you home and 2 weeks later you fall and come back to the hospital and we start over again.
Yeah.
So it's important to just get it done right now.
Yes.
Think about the longevity,
It
right?
is.
We're not talking sending you home for a couple weeks. We're thinking about sending you home and keeping you there for years and years and years. To wrap things up, I think we've had a really good conversation. I want to open up the conversation to your favorite patient experience. Can you think of one story that is always your go-to?
Yeah. So this was, how timing works. So it happened last year on Valentine's Day. So this was when I was still a night shift nurse. I came into work. I got a report. The patient wasn't even there yet, but they were like rolling in. Essentially, it was about this, I think he was like in his 40s. He was pretty young. This casino dealer here in Las Vegas. He was working on his motorcycle at home and he collapsed. He ended up having a heart attack. He came to our hospital through the ER. They brought him to the cath lab. They showed like blockages in his heart. They ended up having to do chest compressions, and they shocked him 40 times.
Wow.
40 times.
How do you even survive that?
I don't know. That's why I'm like amazed that he made it through this.
Yeah.
So essentially he came up with this device called a balloon pump. So we as CVICU nurses can be certified to take care of these patients with this device and essentially helping the perfusion of the heart. It's just a support device that whenever your heart beats, this machine will also essentially beat. It's like a heart within a heart kind of thing.
That's cool.
Yeah. So this patient came up, intubated, of course, because he was still non-responsive, was on this device. And, this was my 1-to-1.
Yeah.
And of course, I was still like maybe a year and a half-ish into.
You must have been nervous.
Yeah, I was nervous because I was like, I've had a patient like this before, but for me to find out he was shocked that many times and he was like down for like more than 10 minutes.
It's like I'm touching a fragile person.
Yes, like anything can happen to him. And I remember I think his wife came in. She was super anxious about what's going on. Is he going to make it kind of thing? And those are always the toughest questions for me to try to even answer.
Right.
It's just, you can't, because anything can happen.
Yeah.
Like you might have a good shift, but then, the next day things might go south. But anyways, the wife came in, that patient came in, we settled the patient, was still needing this device. And I was like, okay, he's my only patient and I have to put in my all because I want him to do well,
right,
Later that night, he actually woke up.
No way.
Yeah, he woke up, and this is when, you're not I bet nobody is comfortable with a breathing tube in. Yeah. So he woke up, a little bit anxious. And all I had to do was hey, you're in the ICU now. You had a heart attack and you're doing okay. So I need you to just be calm. We're going to do some tests and we'll take the breathing tube out. And he was actually very calm when I was talking to him. So he's nodding his head. Of course, criteria for us to take out the breathing tube is if they have to oxygenate well. They're not super agitated. They're very calm. They're following commands kind of thing. And then we were able to take out the breathing tube. I actually don't remember if I had him the next day, but then later on, I just remember, I think I came back on the unit and he was already sitting in the chair. So he was sitting in the chair, no more device. And he was just I can't believe I was dead for that long. And that had happened to me. And then I remember his words of I need to change things around about my life kind of thing. I need to do better when I leave. So,
man,
next thing you know, he's out the hospital. And he actually made it on the news.
Oh my gosh.
Yeah, he made it on the news. And it's I was wait, I took care of him. And the fact that it happened on Valentine's Day, we fixed a broken heart right there.
Oh my gosh. Can't tell a better story. Yeah. Wow.
Yeah.
He's going to be telling that forever.
I know. It's amazing. It's amazing that he got through it.
It's a true testament to understanding that you need to be calm as a healthcare provider.
Yes.
As a physical therapist, a lot of times I'm sending patients home who often are high fall risks. Mm-hmm. And one thing I always do with them is I do floor recovery or fall recovery, where I help them get down to the ground and get back up. Right. Something we pretty much almost always do at some point in our lives. Mm-hmm. But for someone who may be confused or is very weak, a lot of times they freak out.
Yes.
Right. So I'm getting somebody on the floor and they're hyperventilating, they're freaking out.
Yeah.
And if I do the same thing, they're going to continue.
They're going to continue.
Yeah. And so kind of when that patient woke up, if you were freaking out, there is no way that he would be calm as, he would be freaking out too.
He would.
So it's important that you knew your job and the impact that you were doing for him.
Yes.
Yeah. Because it makes a difference.
It does. And it's your aura to your patient. If you're in super frazzled, if you're are going back and forth, doing a million things at once, that patient's gonna see it and they're gonna end up feeling that, you know? That's why in an ICU you want to be as kind of non-stimulating as you can, but also, try to wake them up if they haven't woken up in a while,
right?
You know, especially being intubated.
Yeah.
So I want to say I'm pretty calm when it comes to things, but I'm like I know this is what I need to do.
Yeah,
kind
definitely.
Of thing, because it's just not gonna go well if you're in high strung.
Yeah. So we've talked about your past getting into nursing school. We've talked a little bit about, you personally and the traits that you have to be a great ICU nurse. What's next for Kristen? Is it going to be continuing to be in the ICU, in the cardiovascular unit? Is it looking at other options? What does the future look like for you?
So for right now, I'm okay with where I'm at.
Okay, that's
I
good.
actually look back, I'm like, wow, I actually stayed in the ICU longer than 6 months.
Yeah.
I'm not in the peds unit, which I mean, I respect all kinds of nurses.
Yeah.
Wherever you are, and you have to love it.
Yeah.
Again, challenges in the ICU, but I love the team I work with. Like, I actually like the the cutie, because it's like I may not see these kind of patients elsewhere.
Yeah.
But definitely, maybe in the next, or maybe this year or the next year, I am planning to go back to school. I do want to get a master's in nursing informatics. So,
what is that?
Yeah, so nursing informatics is essentially kind of like a work from home job, where you can either be a clinical specialist or help with documentation and work with providers in terms of making sure the documentation is correct and what they're saying for their patients.
Yeah.
Or you could also be like a liaison between nurses and providers and other people who uses electronic health records.
Oh, okay. That's pretty cool.
Essentially, teach them how to use it.
Yeah.
And I'm very big on technology evolving.
Yeah.
And definitely how our system is
Oh, yeah.
at our hospital. But if I choose to go that route, I definitely want to teach others. I love teaching people. I've precepted students, precepted new nurses. This is in a sense that I'm well, I'm pretty well versed in technology. I want to learn more, and then maybe this is something I can do.
Yeah.
So that's where I'm looking at. So going back to school.
Yeah. That's pretty cool.
Yeah.
That's exciting, but also nerve-wracking to kind of go out a different route.
Yes.
But it's good that you enjoy being an ICU nurse.
Yes.
Yeah.
I do. And it's, again, the people you work with make a difference. The attitude you bring to the unit, and for yourself to remember why.
Yeah.
Such a big thing. And I have to remind myself, at the end of the day, it might have been a hard shift, but I did what I could.
Yeah.
And even the smallest thing made a difference to that patient.
Yeah. Yeah. That's awesome. Well, I've enjoyed sitting down and talking to you, learning more about what it takes to be a nurse and to continue to be a nurse.
Yes.
I wish you all the best for your future endeavors, and thanks for coming on to the PT Lounge. Appreciate it.
Thanks for having me.
Yeah.